Hi, welcome to Bad Takes. I'm Laura McGann, the executive editor of Grid, and I'm here with contributing editor to Grid, Matthew Iglesias. Hey, Matt.
Hello.
Hey.
How's it going?
It's going all right. So this week, I've brought the bad take.
Great. What you got?
All right. Here's my bad take. So just to set it up, Politico has this story on the Biden administration's decision to release a data set as an aggregate data set. They pulled information from hospitals nationwide on COVID-19 spread in their facilities. So They have the data broken down by hospital, but they considered releasing individual hospital numbers. Instead, they're doing it in the aggregate.
Okay.
And they have some stated reasons why, patient privacy, and also just, it sounds a little bit like they don't want to embarrass individual hospitals. And so, the merits of that we can get into. So the take that I'm bringing today, I feel so awkward to read it because, I'll get into why, but here is the take.
Okay.
So it comes from a disability rights advocate.
Uh-oh.
I know. So normally, this woman, her name is Mia Eves Rubley, and she's, a significant voice in the disability rights community. I believe she's at Center for American Progress. And here's what she has to say about the situation.
Okay.
Here's what she says to Politico. Not knowing what the likelihood of getting transmission in the hospital really impacts an individual's ability to, quote unquote, make a personal decision on their risk levels, she said. And she thinks that there should be full disclosure, what hospital
has the most intra-hospital transmission, right?
Yes, exactly.
Okay.
And she herself has a lung condition. It makes her susceptible to COVID. So she's speaking on behalf of people in that situation who might have a condition that puts them at high risk for COVID and complications for COVID.
Okay, let's try to contextualize this.
Yes.
Because I think there's like two pieces of context that are relevant. One that's probably obvious and one that's a little less obvious. So I'm going to go with the less obvious one. There is a sort of well-documented issue that because hospitals are full of sick people, infections often spread from patient to patient inside a hospital, right? It's like it's not supposed to. You're supposed to be able to come into a hospital for treatment and like come out healthier rather than sicker.
Sure.
But sometimes infections spread internally to hospitals. And an idea that has sort of circulated around public health communities for a long time is that the government should monitor, intra-hospital transmission of infections, primarily bacterial infections. And, there's a bunch of different things you can do with that data. Most simplistically, kind of like shaming hospitals that are doing a bad job. You can tie compensation to it. I mean, you can do a lot of levers. And this is like an important issue in the whole history of medicine, right? You go back 150 years, there was like a push to get surgeons to acknowledge the germ theory of disease, start, washing their hands, right? So there's this whole tradition of sort of public health concern about intra-hospital transmission of infections. Which hospitals are using the best protocols? Which are using the worst? How can we give patients information? How can we incentivize hospitals to do the right thing?
I would just want to say that it has worked. Our former colleague Sarah Cliff has covered this extensively. She covered this case of a central line. It's a very millions of people have a central line put in every year. It's a way to very effectively and efficiently get medicine straight into the heart. And there's a 5-step process you can do to prevent infections, but there were certain hospitals where these infections were just, killing a lot of people. I mean, it's just tragic, needlessly killing people. So if you look to individual hospitals that were succeeding in having 0 of these, you could learn something. And what she found, there's a hospital in Baltimore that implemented just a 5-step list, and the infections ended. They now have a 0 central line policy. So it really can change lives to monitor how these things are unfolding in a hospital.
Right. So I mean, essentially the proposal that has been rejected here is to treat intra-hospital transmission of COVID the way advocates, and so the government has to some extent treated these bacterial infections. And so the Biden administration said, no, like we're not going to handle COVID that way. The other issue is that there is this dispute where the Biden administration, it's like coalition, includes the hardcore COVID hawks. And for a while, the Biden administration was like on the COVID hawk side of various policy debates. But over the course of 2022, they have abandoned that position and sort of moved to the center on COVID policy. They've said vaccines exist, vaccines are available, people are eligible for booster shots, but they are no longer fighting for mask mandates. They're no longer fighting for vaccine mandates after having lost some court cases over it. And so the woman, you had the scare quotes, right, around make their own choices.
Oh, and just to say, this was I thought, on one level, just a real quality troll here, because she literally said ability to quote unquote, these are her words, I'm not putting them, and make a personal decision. And she's clearly saying, hey, you've turned away from the hawks, and now your view of your COVID policy is really about individual choices. So she's sort of flinging this back.
And I mean, I think that's like the critical contextualization here, because she has, and a group of people who are quite vocal on Twitter have the view that, like, not that the Biden administration made a mistake in judgment on this hospitals issue, or that they made a mistake in judgment on, like, they don't wear masks in the White House. I don't want to say nobody does it, but, like, the White House for a while had a rule that their staff was all wearing masks as they work in the West Wing, and now they don't, right? And so there are COVID hawks who feel betrayed, like, in a big picture sense, by Joe Biden. And that's why she is... There's like a way of expressing yourself on some issues, and you can be like, people we should all be able to agree that, like, we should publish this hospital data. But, like, she's not saying that. She's saying the opposite. She's saying, I am upset and I have a fundamental disagreement with the Biden administration's individualized approach to this. And I'm now, like, knifing them on this hospitals question, because I think it is just the latest example of Joe Biden normalizing on COVID policy and, like, no longer, because, we do track these kind of specific hospital-borne infections. But I think what the Biden administration would say as to, like, why they don't want to do this for COVID is that we don't, in general, like, we don't track intra-hospital spread of flu. Right? We don't track intra-hospital spread of, like, rhinoviruses. Like, it is a thing that happens that, like, people have respiratory illnesses and they cough and germs waft around in the air. But we don't, the central line infections are a medical error. Like that's how they spread.
I want to jump in and explain why I brought this as a bad take, which is what you're getting at here. I think just to narrowly explain what I'm thinking about this is that the reason I was uncomfortable is I am an editor, I'm a journalist, I run a newsroom. I tend to be in favor of more data, more information, disclosure. In this case, I'm quite sympathetic to not disclosing the data, because what the aggregate data seemed to find to me was pretty surprising. That in January, when there was a surge, nationwide in COVID, 3,000 people a week were contracting COVID in hospitals. And when you think about that, when you're looking at a system of 6,000 hospitals nationwide, to me, that's a fairly low rate of transmission. They looked again, they picked these kind of two samples, and in June it was at 1,500 a week. And so when I look at that data, the idea that releasing, there's real value in aggregate data, which is, to me, this is saying, actually, surprisingly, it might not be as bad as you think. I thought it would be worse. I thought it'd be a lot higher. Two, so then when you're looking at individual data, it's like, well, some hospitals might look great, but they could have just been fluke in not the right, they're in an area with high vaccination rates, or they're in an area where there just wasn't an outbreak and they were in a rural part of the country or something. And so it just isn't, to me, a good method to pick a hospital to get treatment. So from a narrow sense, I feel uncomfortable because I am pro-transparency, but in this case, I'm not quite so hung up on the fact that we don't have details. But to your second point about COVID hawks, I think this is going to be a place where you and I disagree. I 100% agree that this is really the point that she's making, right? That the idea here is, especially amongst people who are at risk or higher risk of complications or higher risk of contracting COVID in the first place, that people like I don't have any kind of conditions that would make me particularly susceptible to a terrible COVID infection. And, maybe I can make personal decisions in my life about what I want to do. But when you're in a position to not be able to make personal decisions like that you are at higher risk and you're counting on your community to help protect you, this is really frustrating and dangerous and really about your life. So I am far more sympathetic and closer, I suppose, to the hawk view than maybe you are.
So I really I think it is obviously true that some people are at elevated health risk from COVID than others, but that there has been this construction in lefty internet circles that is what the politics of COVID are really about. And I think that there is a non-factual element to that assertion. A tweet that I saw, from an account, it's just WSBGNL. I don't know who it is, but it's a reasonably well followed account who got 4,000 retweets, 16,000 likes with this. He said the other day, it's amazing how many people shrug off the issue of medically vulnerable people being effectively excluded from indoor public places indefinitely, but also claim it's unsustainable for mental health to ask people to wear a mask or skip indoor dining for any length of time. And this is an on October 1st tweet, and I feel like it's unfrozen caveman commentary from 2 years ago, where the reality is COVID happened. The period of time in which it might have been possible to stop COVID from spreading everywhere has come and gone. Vaccination is available. The vaccines work as well as they do. We can argue about how well they work. I think they work pretty well. It's a large relative risk reduction. But either way, it is the equivalent of saying that we should put society at all times on emergency footing because people sometimes get the flu. And it's I'm not a flu minimalist. If you went back in time 5 years ago, I was a flu maximalist. I would do articles being not getting your flu shot is seriously immoral. This is a bigger deal than people realize. I thought it was great. I thought an unheralded aspect of the Affordable Care Act is that for the first time, it made flu shots free for everyone. I think flu shots should be cheaper than free.
You should get some kind of incentive, yeah.
You should go to CVS and they hand you...
No, I agree. I agree.
Because I take this more seriously than most people. At the same time, it's one of these things. I wish that it didn't get unpleasantly cold in the winter. But it does. I wish there were no respiratory viruses, but there are.
I think you're saying there's an extremist position that the lefty Twitter is taking here.
I don't even think it's extremist. I actually think it's would they want to say, because there's these right-wing COVID minimizers who I think are really wrong. And what they want to do, what they've been saying since March 2020 is the people who think this is bad are mistaken. And actually it isn't bad. And that's wrong. It is bad. The left-wing people who are this is very bad, they're absolutely correct. But I think that's all you can say about it. It is a bad thing that happened. We should not have let it happen. That was bad. And we should take action in the future to prevent future new viruses from going endemic, precisely because this is so bad. Given how bad it is, the idea that we should remain on permanent emergency footing, where everybody is wearing masks all the time, or cities are shutting down their restaurants, that's crazy.
Well, that is crazy. That is too much. But I think that there is a space between what you're saying of super inconvenient, everybody is on lockdown forever, and let's do nothing. Because we have seen, and I have also heard on the Twitters from the sort of the push, when I see this pushback against some of the, the pushback that kind of like maybe you're laying out here is that, and something that comes up sometimes, is that mask mandates don't work. And I disagree with that. You can look at evidence. I mean, Vanderbilt did a great study on this and took a look at what happens when a mask mandate is lifted. And the most concerning thing to me is that hospitalizations go up. And when you have a mask mandate in place, you tend to have a flatter curve. And this is a huge problem in the United States. It's not just about you getting COVID or me getting COVID or anyone getting COVID, really. It's about, well, one, COVID treatment, people who are hospitalized. Many of them are vaccinated, and the people who end up in the hospital, have some reason to be there. Two, when you've got an overwhelmed hospital system, it affects the level of care that other people are getting for their other problems.
Absolutely. But okay, so I have two lines of disagreement with that. Like, one is, I want the people who are talking about this, right? Like, you have to try to take a comprehensive look at costs and benefits of things. I know maybe you couldn't, but I think this specific thing about the hospitals is a good example, right? Where it's like, we should think seriously, if we tell hospitals that they are going to be named and shamed based on intra-hospital COVID transmission, that could have negative comprehensive implications for the quality of care that is being offered there, right? If it makes it harder to recruit and retrain personnel, or if it leads patients to make decisions based on kind of invalid data. Now, on the other hand, if we can develop scalable solutions, right? So there are people who tell me that there's a special kind of far ultraviolet light, right? Far ultraviolet light kills viruses. It kills COVID viruses, it kills flu viruses, it kills all kinds of viruses. At the current moment, these far ultraviolet lights are probably a little too expensive to tell every hospital that they need to go put them in. But we could be putting money into research of far ultraviolet lights with a long-term goal to getting first in hospitals and other places where medically vulnerable people are likely to be, and then later in broader and broader swaths of society should be equipped with far ultraviolet lights that kill viruses. We know that high-quality air filters reduce COVID transmission, but they also improve indoor air pollution. They have a lot of different kinds of benefits in that regard, and we could be trying to roll stuff like that out. When you talk about things like that, there's benefits, and then there's also monetary costs to doing it. So there's a question of at what scale do we do it, et cetera, et cetera. I'm pretty enthusiastic though. I would like us to push for these kinds of things because they are viable steps to make the world better. What I feel is actually happening, why I found this take to be bad was that instead of saying, okay, I looked at this hospital issue, and here are my reasons for believing that publicizing information about COVID transmission will be helpful. Instead, it was here is my bitterness and sarcasm that Joe Biden has tried to normalize the situation after COVID. And so it's back and forth identity politics. People who disagreed with the decision to normalize want to reassert the meritoriousness of 2020 style emergency footing policymaking without reference to and we had another wave of this when mask mandates on public transit came off. I 100% believe that if everybody wore a mask on mass transit, that would reduce virus transmission. And it might even be a good idea to make everybody wear a mask on mass transit. But that wasn't the situation when the mandate was lifted. What happened in the months before the mandate was lifted, I ride on mass transit, and people weren't wearing masks because there was no enforcement. Now, some people were, but other people weren't. And there was absolutely no enforcement of the rule. So it's what was the value? So
the value of these mask mandates is that even if you don't have 100% participation, there does seem to be a link between the mandate and, for example, hospitalizations of COVID patients. And even though visually your eyes are looking around a metro car saying, not everyone's wearing a mask, what's the point of this mask mandate? Well, you need to step back and actually look at, well, what do they do? And we now have more data looking backward at what happens when you lift mask mandates. And that what it turns out is that there is evidence that even if not everyone is complying, and this study came out of Tennessee, like this isn't from, like a state that I would assume has high compliance. I think we can make that leap. And so if you have some portion of people following this rule, that you actually do get some effect. So dismissing it as, well, it's worthless because not everyone is complying is just simply not true. So if you're trying to weigh the cost benefit, you have to factor in that there is a benefit. You seem to be dismissing that.
I'm not dismissing the benefit exactly, but like, I just think it's like tough to ask public officials to keep unenforced rules on the books indefinitely as compliance declines. Like it has I think like a corrosive impact on society.
I mean, I don't. So there you go.
Okay.
I just think it's like, just because it's inconvenient to be a politician doing a thing.
No, I mean, it's not the convenient. I mean, I've become a fanatic about this, but I think like everyone who breaks the rules should be apprehended and punished. And that if we look at it and we say, I don't want the cops like dragging somebody into jail for not wearing a mask on the bus, then it's like, don't make people wear masks on the bus.
Well, the other thing you could do, like make KN95 masks widely, like put them everywhere, normalize them, put them everywhere and say, if you want to get on the bus, you have to put this on. If you want to come into the store, you got to put this on. Like have them everywhere. And that could be a way, it seems like the disability rights groups have pushed for that, of access to masks, because it just would make it easier for some people who do not have access. I mean, you and I probably, I don't know for a fact what you do, but I order my masks online. 40% of people with disabilities don't even have access to a computer, not the internet, a computer. So what are we doing for people who want to comply but can't? Like you just can't order KN95. So what if we made them mass available and approached it that way, which we never really did. So I think that instead of saying, you know what, throw your hands in the air, it's politically inconvenient, there's no benefit, let's just forget about it. One, doesn't look at the actual facts of the situation, that there seems to be some benefit. Two, assumes that the only way to entice people to follow a rule is to punish them, instead of making it just really easy to follow the rule, which we didn't really try.
Let's take a break, and I want to talk about things that we haven't tried. So, I mean, I could not agree more strongly about the fact that, like, we have not done an adequate amount, like, on the mask supply, right? I mean, it's not just, like, the simplest thing. We should have a much more reliable system for a consumer to tell whether they are getting an authentic KN95, N95 mask, right? So, like, the basic building blocks, like, if there had never been a COVID emergency, right? Like if we had just like society had never gone into emergency mode, but this virus had existed and like some people wrote articles that were saying good masks will help you not get COVID, then some people would have started selling fraudulent masks. And then just like the most obvious thing for like big government liberals would be like, that is bad. You should not be allowed to sell fraudulent masks. We are going to make sure that Amazon and Home Depot and people like that are labeling everything correctly and know what they're doing. And we haven't done that. Then it's a public health benefit. I was saying like flu shots should be cheaper than free.
Well, I'm going to also say the CDC did create, and look, I do want to talk about the CDC in a minute too. But one thing they did do that was helpful to me is they do have a link on their website where you can click directly through to purchase masks that are good. So it's not that there was nothing done, but at the same time, it like you're talking about, okay, well, why wasn't there a mass crackdown on these fake masks makers, which I agree, like the Consumer Protection Bureau, which I guess split up recently. But in any case, that would have been a great thing for them to crack down on. And at the same time, instead of thinking about the crackdowns or enforcement through punishment, make it really obvious and easy where to get a good mask. Like set up stands everywhere, have them around, like make them just widely available.
And then yes, so there should be masks for free at the airport, at metro stations, etc. I 100% agree with that. I will go further than that because like I think I'm like better on COVID than the COVID hawks. Like there should be a guaranteed purchase agreement that if you can manufacture a mask that exceeds the quality of N95 masks and meets some like cost and comfort threshold, the government will guarantee purchase of 150 million of them, right? Like we should be willing to spend gargantuan sums of money on developing like better masking technology that will get more people to be able to use them, that will get more mask availability. We should do the far ultraviolet lights. The craziest thing, I mean, an article that ran in my newsletter by Patrick Collison, is the founder and the CEO of Stripe. He has also been funding a lot of medical research. And, he's doing a piece. He's saying his grantees who are working on vaccines, this is like the government wants people to improve COVID vaccines, apparently, but Operation Warp Speed is done. The vaccine development emergency is over. So he has all kinds of people who he's funding who are facing problems in doing their clinical trials on the order of they can't get monkeys because the Customs Bureau is like understaffed and it can't clear test monkeys for import. Or in order to do an efficacy trial of your candidate vaccine, you need to compare it to the vaccines that we already have. So to do that, you need a bunch of doses of existing COVID vaccines. And even though the United States of America has plenty of vaccine supply, you're not allowed to just like go to a store and buy a bunch of doses of vaccines. So researchers can't get them. These are people who are working on nasal vaccines that would block transmission, who are working on multivariant vaccines that could get us out of this kind of variant hell. The thing about these kind of policy levers that I like is that they would actually save lots of people's lives in a way that's politically, socially, and economically sustainable. But I think that like the reason like COVID hawks don't like to try to talk about these issues is that what they want to do is keep rehashing the political arguments of 18 months to 2 years ago. And it's just like, it is unproductive. A lot of people don't care about COVID at all, which I think is bad. But it is like incumbent on the people who do still care about COVID to think about like, what are realistic asks? Like get the freaking extra staff into the Customs Bureau so that people can have the lab animals they need to research better cures and better vaccines. Let's get like real long COVID treatment centers up where we do like meaningful diagnostic screening on like who actually is having post-viral syndrome and like do medical research on this. It's fallen off the NIH funding priority list. So it's like back up to cancer, heart disease, which are important problems themselves. But like in terms of like meaningful public health policy levers, we are falling away. And then people just like so want to fight. Like this hospital thing, like, I don't know. I guess we were agreeing on this part, but like it won't do anything.
I never want to say, oh, this is a terrible argument. You should be, what about all these other things? But what you're getting at here, I do agree with that it is pointless to me to be out there pushing the idea that if you don't support mask mandates or whatever you don't support, that you are actually, just so you know, you hate people with disabilities. Like you are a bad person. You are a morally bad person. And it's like, well, to what end? Is that going to be helpful strategically? I mean, making people feel bad. And the fact is, like you're saying, there are other issues here. I mean, I think that there are things we could do right now and we should be pushing for right now to help people right now. I mean, we need to try. And then two, we do need to invest in things that could potentially help people in the short term, but put us in a better position for the next time this happens, which, it will happen again. We will have a mass outbreak of something and we will need to have better testing protocols. We're going to need better mask mandates. I implored that Operation Warp Speed has been suspended. Like, why aren't we still doing it? Operation Warp Speed right into the future. It's ridiculous. So I think that in some ways I am maybe framing my argument as a defense of this sort of strain of hawk that you're talking about, when I do agree that there is a bad take out there that the way to talk about COVID is if you are, if you are not in their camp, you are morally deficient because you don't care about a certain group of people, is just not a helpful conversation to have. So I agree with that. But I also, and I know that maybe, you're saying you do agree with these sort of pushing forwards and the make it easier for researchers to do their work. And I'm glad that was in your newsletter. But I will say, I don't know that your representation on Twitter of your positions reflect this nuanced conversation we're having right now. So as much as you're frustrated with sort of a conversation that's happening that's alienating and not useful, I would say you're not exactly being the change you want to see in the world here. Like, you're creating a sort of position that feels very flip, and I don't feel that I identify with.
I mean, I feel increasingly flip about it because the people who say they are fired up about COVID are like not doing the work on any of this. Like, you're talking about a staffer at the Center for American Progress. This is an influential progressive policy organization that is close to the Biden administration, that is close to congressional Democrats. CAP, as an institution, does not do any work at all on improving and speeding vaccine development. It is incredibly frustrating to me. And I have lost it with the COVID advocacy community over their own total inattention to the issue that they claim to be focused on. You say I think honestly, I have done more on this issue of vaccine development than the vast majority of self-described COVID hawks. And it is incredibly frustrating that the people who have formed their political personas around the idea that we're not doing enough to fight this pandemic, that all they want to do is fight about freaking masks or deny that there's educational costs to children of the stuff that they put forward. And I don't know, I will try to engage in a more earnest and forthright way, but it is literally the job of disability policy advocates at think tanks to try to think in a serious and rigorous way about what is a policy agenda that has a real chance of moving forward and being helpful. And the extent to which this has become deprioritized, we had an Operation Warp Speed for COVID vaccines under freaking Donald Trump, and that is what is crazy, that the Democratic administration, that the liberals took over and are so much more invested in the kind of status quo operation of the public health bureaucracy than they are in trying to move forward on what they themselves claim to believe are important problems. And I'm going to stop talking, but I'm very frustrated.
I hear it. Look, and I read your stuff. I've been reading your stuff for a long time. And the issue I'm just raising here is that the day-to-day conversation sometimes is you've emerged as this other camp that I find off-putting, of this sort of snarky dismissal of, I'm kind of standing over here I don't know, I have a family member who was diagnosed with diabetes, and there's now emerging evidence about kids and diabetes, the percentage of kids, I guess, up, one study says up 40% since COVID. They think there's a link. I have another family member in the hospital right now. He has severe asthma and he got COVID and now he's there. And so me standing here looking at the conversation unfolding, I don't feel like the disability rights argument right now of just being kind of, to me, like you're saying, not making much sense. What is this doing for anybody? But I don't feel like the kind of intelligentsia's flip response sometimes is that appealing to me. And so I have read all your work, and we talk all the time, so I understand the context. I'm just letting you know. I know,
have a lot. But I'm letting you know. I'm letting the world out there know that I am I don't know.
I just think you should do a better job representing the work.
I disagree.
You did the work and you put it out there, and then you You've done all this work, and then you send like some flip thing.
No, I just like, I feel like there was an opportunity. I don't know. Like, honestly, like the more I talk about this, like the less sympathetic I become to the advocates in this community, because like we just like had this like agonizing period of like over a year after vaccines became available, when it was like, let's just put all our energy into an obviously doomed rearguard battle about schools, about masks, about restaurants, about bars, about who can do what on the bus and the plane, and like giving away chance after chance after chance to like move forward on medical and scientific research and develop like real solutions about things. I mean, I don't know like who's flip and who's not. I was down on Capitol Hill the other day, and I was there to talk to a member of Congress about something totally unrelated to COVID. Also unrelated to COVID, there was a protest about Puerto Rico that was happening outside the Longworth building, and it was like a real leftist, like Puerto Rican kind of thing. But one of the guys talking at this had a Repeal the Jones Act t-shirt on, which is like a centrist neoliberal cause. And so I thought it was funny that this like group of leftists was also agreeing with moderate neoliberal shills about a shipping regulation on Puerto Rico. And I was like shorthand, trying to offer a shorthand description of the situation. And it was that the woman speaking at this rally, which was outside, she was like on wearing her mask outdoors. And I was like, we've got a big tent on the Jones Act. Like, even these Puerto Rican independence protesters wearing masks outside are saying we need to repeal it. And then I got people yelling back at me. It's like, well, why make the comment about the outdoor mask? Like, are you anti-mask? I'm like, I'm not anti-mask, but like wearing a mask outdoors in the year of our Lord 2022, like that is a political identity marker. It's not a public health intervention. And like, I think everybody in like reality is aware of that fact, that like, that's what's going on, that people have developed like highly partisan ideological views around this. And a public health intervention is like stepping in and asking about vaccine development and Paxlovid distribution and like real stuff. And I love that conversation, and I would love to engage like much more earnestly with a bigger world of people who are talking about like, how do we start distributing virus tests?
So what did you think was going to happen, though? What did you think? What did you think was going to happen?
I mean, I thought that a bunch of people...
But if you're like, I want to have this conversation, and you're just sticking the stick in the cage.
No, I want to have a conversation with people who want to have the conversation. I think that the people in the, like, COVID community, like, don't care about COVID or pandemics or viruses or public health. And, like, I'm not interested in engaging with them.
So why are you engaging them?
I was trying to engage with the guy.
You totally knew.
No.
You knew. You're like, I'm going to make this mask comment.
This is what I'm saying. This is what I'm saying. I didn't even occur to me that had anything to do with COVID. All I was trying to say was that leftists were interested in the Jones Act, because the Jones Act is interesting.
I agree. It's interesting.
Because I take it for granted that like people wearing masks or not has nothing to do with COVID policy. It's like just identity politics.
Yeah.
Which is fine. Just like some people at that rally are like wearing Che Guevara t-shirts or whatever else. Anyway.
I think I have one other factual thing just for you to know of the hashtag actually, is that the newer variants have been shown to transmit in crowds in ways that previous variants haven't. So,
yeah,
I do agree that by and large, what you're looking at when somebody's wearing a mask outside, it's a political signal, right? Of this is who I am. I'm a person who wears a mask because, this is who I am. And at the same time, you might want to think about wearing a mask when you're in a crowd. Just saying.
No, I mean, to me, this business with the variants is like the opposite, right? That it's like, I don't know, that like, we're beyond the point where these kind of interventions will meaningfully halt the transmission of the virus on a society-wide basis. Like, that's why we need to invest in technology and medical treatment and start getting ahead of these variants instead of like this back and forth on the scolding. Like, that's my serious policy view here. Like, we need to try to develop a pan-coronavirus vaccine that will get us ahead of the variant chasing curve. And like, if there are people who want to come advocate advocate for money for that, for regulatory changes for that, for other things. I am like 1,000% behind them. But like, it is frustrating to me that the mainstream liberal advocacy community has completely orphaned this topic as like a subject of discussion. And like, I don't know why that is, but it makes me very upset that like there are people adjacent to like the corridors of power who are more fired up about COVID than I am, but who are nonetheless like not trying to like find like real paths forward. And to me, because I do want to draw this back to like our original thing, this hospital business is emblematic of that, because the central line infections, that's like a very real issue, you know, where hospitals that use like good practices have radically fewer of those infections than hospitals that don't use best practices, right? It's like actually quite important to do everything we can to like incentivize and urge hospitals to adopt those best practices on central line infections. The reason that we can build policy around that is that we actually know what the best practices are and that the best practices are highly efficacious. If somebody shows me, look, here's a thing that hospitals can do that will radically reduce COVID transmission, then like obviously we should urge hospitals to do that thing. But absent having like done the work of identifying what is it you want hospitals to do to reduce intra-hospital COVID transmission?
Right. This was what I was hung up on, which is, what good is this data? You know, what do you want these hospitals to do? It's not the same as a central line where there's there's 5 steps. It's a checklist to preventing it. COVID is an airborne disease, and there's only so many things you could do. You could have HEPA filters, you know, et cetera, but you can't have a zero. I mean, you could be China. Good luck. You can't have a zero COVID policy. It's not going to work. It's not the same. It's just the spread is not the same as, like you were saying earlier, a medical mistake.
And I think we should look at what kinds of air quality upgrades could hospitals like, I don't know. I'm not an HVAC engineer, right? But it's like, it's plausible that there is something on air filtration that we should mandate hospitals do. It's like also possible that there isn't. You know, it's like you kind of have to look at it.
Look, I don't know about hospitals in particular, but I do think the HEPA filter, we know that there are long-term benefits beyond COVID for, you know, in injecting cleaner air. And so why not? You know, we were talking before the show, I guess. I don't want to go off topic too much, but we were talking about building code before the show started. And, you know, we could say, hey, all new buildings have to have a higher standard of HEPA filter or a higher filtration system or some such. You could do that. And going forward, that I think would be a huge benefit. I think that we are agreeing that this is a bad take. I think our disagreement is just around sort of the vast sea of people who are watching conversations unfold. And I hope that this conversation we're having, you know, reaches people who are interested in it, because I think what you have done a lot of work on COVID that I think goes unrecognized, and people should read, and people should check out, and people should listen to. What I'm pointing out is just the reflexive, letting your sort of
I
feelings overcome you, and I get it, and I you know, and it's you need outlets to express yourself, but I am flagging that there's a whole world of people out there who are kind of watching and want to be brought into a conversation, and it can be alienating. And I don't usually say that. I mean, look, I love your tweets. I like they're
no,
good.
You do. Look, I think,
you know, I'm just raising a sort of, when you're criticizing a group of people for saying dumb stuff on Twitter, like, you gotta really, you know, hold a mirror up to yourself before you go there.
But I to me though, like, this is not about like what do people say on Twitter. It's about what do they do in their professional advocacy work, and what do they emphasize, and what do they care about. And it is absolutely true. You know, I'm a relatively privileged, middle-aged, above average income person. Most government policy stuff doesn't have super direct impact on my life. The first time in my life that I think public policy decisions have made a super big concrete impact on me has been during COVID, in which I think COVID hawk overreach, starting from shutting down playgrounds in April of 2020, has really made my life much worse. It has been significant impairment of my son's cohort of, at the time, kindergartners ability to learn to read and do math. I think that there has been a total failure in the COVID hawk community to acknowledge that any mistakes of policy overreach were made, or to in any way readjust their goals or their conception of things. And they keep having this sarcasm about not just a niche community, but the majority of Americans, who need their lives to function in a reasonable way. And we need to focus on policy suggestions that have some real odds of success and of improving aggregate public health in the United States, which has gotten much worse since the COVID pandemic, in part because of people getting sick with COVID, but also in part because of lots of secondary consequences of people skipping medical screenings, I'm
going to stop you because you're at a good, I felt like I'm going to cross the T because you made I think that's a good place for us to end the conversation because you've encapsulated what you're thinking.
All right, let's do it. Let's make things better.
Yes, good. Let us do things that make things better now and in the future. I want to flag Grid. We've done a lot of COVID coverage. Our science editor, Lauren Morello, is great. You should check out Jonathan Lambert in particular. I also want to flag, I guess I'm doing a lot of promos here, but we have a new health newsletter. It comes out on Fridays, and I learn a lot from reading it, and I learn a lot from reading Jonathan Lambert in general on COVID. I think that our coverage really has been focused in a way on how do we move forward. And hopefully, Matt, you'll find it actually constructive.
Well, actually, can I specifically flag the January 21st piece that Jonathan Lambert did with Dan Vergano and Maggie Severns that was on this sort of Biden is the pandemic over kind of piece? I thought that was I thought it was a really good article, sort of trying to take stock of, okay, it's not over.
Right.
So what actually can we do to make things better?
What do we mean by things? Yes. Yes.
Which I think is the right question, right? Because that was Biden being flipped. It is a virus that exists, and we should try to make our lives be better rather than worse.
Yes. There was an instant reaction to that comment all over. It was it's not over. The pandemic's not over. It was well, I mean, Biden knows that it's not over. And then we had three smart people kind of unpack okay, well, what does this mean? Where does this take us? I don't know. I think we should end it there. I think we're in a good place. Do you want to wrap up our show?
Oh yeah, absolutely. I love to wrap things up. No, so listen, this has been another episode of Bad Takes from Grid. Our producer is Olivia Reingold. We thank her now and forever. I also thank all of you who have been listening. I still hear from people who are man, when are you going to start podcasting again? Which I guess means I have not tweeted enough about the show.
That's a tweet. That's a good tweet.
It also means that you, the listener, have not tweeted enough about the show and told your friends and everyone out there. Podcasts spread through word of mouth, so do your part, and we will be back next week with more Bad Takes.